Hello everyone on this call, on this webinar. I'm here with Costa. I'll give a little bit of a more official introduction in a few minutes. We are first waiting for more people to connect as they are connecting as we speak, and we will officially start in a few minutes. So in case you're worried and you feel alone on this webinar, do not worry. There are already 41 participants as we speak, and more are joining.
Yeah, it's so silent here. Everybody thinks it's not working.
Everyone's on mute.
Yeah, you have to sing a song or something like that.
Actually, that would have been a nice idea, but I don't know how to play a song through these two. I'm just waiting 2 more minutes. And I see that we have attendees from all over Europe and parts of the world. So it's very nice. We'll wait 1 more minute for the late ones to connect. All right, it's now 3:05 p.m. Brussels time and Vienna time and Lower Austria time, I believe as well. So a warm welcome to all of you. As you all know, emergency services are on the spotlight during this pandemic, and they are uploaded all over the world for protecting us and for saving lives. In these extraordinary times, emergency call centers had to quickly get prepared to face a surge in emergency medical calls, but also to protect their staff and ensure continuity of service. General trends that EENA has observed is a general increase in emergency medical and non-emergency medical calls, obviously, and a stagnation or a decrease of other emergency calls. We will hear today from the Mr. Christoph Kvojka, aka Costa. Some of you may already know him as he's a regular speaker at EENA conferences, and he has also received several 112 awards. Without spoiling his presentation, you will hear, and this is not exhaustive, how his organization, Notruf Niederosterreich, has managed to continue answering emergency calls in seconds, when at the same time keeping high standards to respond to COVID-19 non-emergency medical calls. All this while protecting call takers who were answering calls from home. Costa will also share some words about the general Austrian actions in the context of the coronavirus, And as you know, Austria is considered as one of the EU countries which has dealt with COVID-19 successfully at this stage. This webinar should last about 1 hour and will be recorded. Costa's presentation should last about half an hour, and it will be followed by a Q&A. For the Q&A, please feel free to write your questions in the section dedicated to questions, or to use the possibility to raise your hand in the tool that we are using today. And in that case, we'll give you the opportunity to speak and to ask questions to Costa right after Costa's presentation. Without a further delay, I give the floor to Costa.
Thank you very much. So I will share my screen now. Hopefully it's working. And yes, Gary, could you see it? Yeah. So my name is Christoph Konstantin Kwoika. Just 1 second. And I'm the manager of Notruf Niederosterreich. Notruf Niederosterreich is a government-owned private company. I'm normally a CEO like every other CEO with a lot of hobbies. I'm skiing very often. I'm playing golf. I'm driving a motorbike, but I'm also enjoying time with my family. In living in a small village near about 40 kilometers north of Vienna, and spending a lot of time around the world every year. I'm between 100 and 150 days in hotels around the world as I'm an advisor for governments in restructuring public safety. Today I will tell you a little bit about Notruf Niederösterreich and how we were dealing with the COVID crisis. Notruf Niederösterreich is responsible for the eastern part of Austria, the state of Lower Austria. Austria has 9 states. The biggest is Lower Austria with a population of around about 2 million. We are doing all the medical services, medical emergency numbers, medical information lines, and we are dispatching around about 800 ambulances every day. There are around about 220 ambulance stations we are dispatching, 68 other stations like mountain rescue, water rescue, and so on. We are dealing with nearly 12,000 doctors, GP doctors. We are also the out-of-hours doctor service in the eastern part of Austria. And we have flat to alpine, rural to urban. We are surrounding Austria's capital, Vienna, a city with around about 2 million people living there. And we're also offering some services for the capital, some services for other states. So we are responsible for the nurse triage hotline for 3 states, all of Austria. Yeah, and a lot to do. The normal call answering time is 4.3 seconds. So we are very proud that there are no queues on emergency numbers, no queues on information hotlines all over the year. The normal call duration on emergency numbers is around about 2 minutes, and we need a little bit less than 1 minute from answering the phone until the alarm is at the resources. Last year we did 1.5 dispatched events where we dispatched resources to any kind of events, medical, fire, doctors, whatever. And we had more than 4 million calls and contacts. We did a little bit more than 3,000 dispatch live support where we tried to save lives via the telephone, and we had nearly a little bit more than nearly 2 times a day via telephone. We gave childbirth instructions, and a child is born via telephone. There are a lot of medical emergency numbers in Austria, well known by the Austrian public. So an Austrian would not call 112 if he has a medical emergency. He would dial 144. There's a special number for the fire brigade, 122. There are several other numbers but also 112, of course, is established all over Austria. You can dial, and if you have a medical emergency, they will connect you to us. New in Austria, and we established this 3 years ago, is a nurse triage system, a medical health number 1415, which became very important throughout the COVID crisis. There are a lot of other lines connected directly to us, so we have more than 300 different lines and routing points connected to our center. Apps are becoming very important in the last year, so we offer own emergency apps. There is an app called Rettung, which means medical emergency, and we offer a special app for deaf people. Are we using AML? Of course, we were one of the first. AML is fully implemented on every mobile call. We have translators for all languages of the European Union and all the major non-EU countries like Russia, Chinese, and so on. We are using all modern systems like IVR apps, Java, whatever you can imagine, FaceTime, WhatsApp, Facebook, Messenger. You can connect. You can connect to us on all these, and we have special apps and possibilities for people with disabilities. The only thing we can't offer, that's because the Austrian providers don't offer it, there is no SMS on 112 or 144. Yeah, the specialities, we are one center on 4 rooms. So it's not 4 centers connected, so it's one center on 4 rooms. And this 4 room strategy is to be resilient against problems we might face, terrorists, blackout, or whatever. We could also work in 1 room, and as an employee, you can choose where you want to go in the morning. You can work from any of these workplaces. A call from St. Pölten is directed to the best call taker and might not be taken in St. Pölten. It might be taken on another place where the best call taker is. Our technique in behind, we have a big technique center in Vienna. It's called the place is called Arsenal. It's the only high security area in Vienna, in the eastern part of Austria, where all the technique is hosted. And if a call is coming in, it's going to our technique center in the Arsenal, and there our computers are looking who is calling, from where are you calling, what is your history, what might be your needs, and because of this, you are connected to the optimum call taker wherever he is sitting. So he might sit in St. Pölten, he might also sit somewhere else, wherever. We have these 4 branches in St. Pölten, Korneuburg, Mödling, and Zwettl. And they all look like this. So it's like all the other call centers, mouse, keyboard, screen, and that's it. Everything is digital. We have digital radio for more than 12 years now, 13 years now. Telephone is digital. We are using Cisco Call Manager platform. And you can work if you have an internet, a mouse, a keyboard, and a screen. You're all welcome to work. So we are offering also home office. Since 2017, it's possible to work from at home, and these are the guys who are doing home office today. 2 hours ago, because I didn't have any pictures of home office, I sent them, please send me a selfie of doing homework today. And this is what some of the people sent me. So as you can see, screen, keyboard, mouse, that's it. That's what you need. We are doing service for all the things like Red Cross, cemeterians, the army, the police, the fire brigade, the government, everybody who needs services in kind of call taking, dispatching, and it's is in any way related to emergency number, we are doing services for them. Yeah, as I said, in the COVID crisis, a new number we established 3 years ago has become very important. The number is 1415, which is a telephone health advice service. The idea behind this is that there was a new service established, a nurse triage service, with the main goal that the patient should get what he needs, not what he wants. So we are re-triaging emergency calls, low-level emergency calls, and telling the people via telephone in a round about 15 minutes call what is the best for them, to go to a GP or to do self measurement, self things you can do without any need of going to a doctor, or maybe it's necessary to go to a hospital or to an emergency room. That is done with low-level calls. They might come in via an emergency number, or they might come in via 1450. So there was a big advertising campaign in the last 3 years to make it public known that there is a new number for low-level calls. The goal is that the patients are directed to the best point of service, which is very often not what they think is the best point of service. Notruf Niederosterreich is doing this service for 3 states. So that's the state of Lower Austria, our neighboring state of Burgenland, and the most southern part with the big border to Italy, Carinthia. And that was very challenging for us because when COVID-19 started, yeah, Carinthia is the neighborhood state from Italy. So Italy is starting somewhere over here and has border to Tyrol and Carinthia. And most of the cases in the first weeks, or in the first week, were coming in from this border. COVID-19, and that's now the situation in Austria, started on the 20th. It started well before. It started, we started to prepare after our skiing holiday. The traditional Austrian skiing holiday is the first week of February. And that's also when this bathing, you might know from the media, in Ischgl happened. The first 2 confirmed cases were in Austria were on the 24th of February. These were the first 2 COVID patients in Austria. And around about 2 weeks after this, we had the first confirmed COVID death. And at this time, the Austrian government announced the shutdown of the country. So it was very early in comparison to other countries in Europe. We got a lot of pictures from our neighboring country, Italy. We got a lot of pictures and a lot of information on the situation in Bergamo and in a lot of other cities. And because of that, it was absolutely clear, and we were really happy that our government was really acting that fast. So in the second week of March, there was a complete lockdown of all business, of all schools, of all university, and there were exit restrictions announced. This all happened in the week of between the 10th and the 17th of March. In around the 20th of March, there were extended lockdowns. So everybody must stay at home. If there was a possibility of home office, you had to do home office. You were only allowed to go outside if you are going to work and work is necessary. If you have to go outside to help somebody else, or if you have to go out to buy food. In all other circumstances, you have to stay at home. 2 weeks after this, and you can see we started the lockdown right over here, and 2 weeks after this, the curve is going down. This is the curve of actual COVID-19, of active COVID-19 patients. So it's not a summary. The most of the curves you can see, it's an endless going up curve of summary of ever happened cases in Austria. No, that's a curve of a diagram of active COVID-19, confirmed COVID-19 patients. And as you can see, nearly 2 weeks after the lockdown, it started going down. So we could start at the beginning of April to reopen a little bit. So at the 13th of April, it was the reopening of small businesses and home tool markets where you can buy tools like Walmart or things like this. Big shopping centers were not allowed to open. No restaurants, no other big markets like IKEA or whatever. They had still to be closed. At the 1st of April, there was a mask mandatory in supermarkets, and up from the 14th of April, there was a mask also mandatory in public transport and so on. And now we are at the 4th of May or the 5th of May, and on the 1st of May, all other businesses were allowed to open again, but no restaurants, no hotels. The restaurants are allowed to do delivery services, and they are allowed to open in the last weeks of May. And hotels may be allowed to open again at the 13th of May, at the end of May. So that were the measures taken by the government. And as you can see, all the measures where the public were informed about COVID-19 were around. We are starting from the 9th of March, and in the second week of March, second or third week of March. And in the second or third week of March, the big call volume was coming to us. As I said, there were big press conferences on Monday, the 9th of March. And as you can see, normally we are dealing with 5,000 to 6,000 calls per day. And it started on the 10th of March, and it nearly doubled. On the 16th of May, we had around about 10,000 calls per day. So we had per hour, there were hours with 1,000 calls. And as you can see, the big line, the thick line is are all the calls coming in, and the thin line is these 1450, this nurse triage, this COVID information helpline. Here you can see only the 1450 calls managed by Notruf Niederosterreich. On a normal day, we had 500, 600, and it was going up to 4,000. So on a not so peak day, we had 400. So we had as a maximum the 10th of what we had normally. And most of the people were calling around 10 o'clock. So the maximum was, when the press conferences were. At the end of the press conference, there was a huge amount of calls coming in. And here you can see 3 lines. The thick line is all the calls coming in. This blue line is the emergency number, medical emergency number, and this red line is the thin red line is 1450. And we are very proud that we had never ever a waiting time on emergency numbers. Because of what I will show you in the next slides, we can make a good differentiation between emergencies, non-emergency, and we had a waiting time on the info hotlines of 3 minutes and 40 seconds. That's also, we are on the non-emergency numbers. How could we do that? Depending on which number you're calling, you are coming to different types of employees. So if you are calling from an emergency number and because of your health record, because of your call record, because of all the data we know, you are then going to an EMD, an emergency medical dispatcher, which is a call taker with the skills of getting an emergency number, and he's doing the triage. The triage is done on these numbers with AMPDS, with Advanced Medical Priority Dispatch System, or if it's a fire call, with FPDS, Fire Priority Dispatch System. If you're calling on an hotline number, on a patient transport number, on an information number, on 1450, you are coming to a call taker. The call taker is not allowed to get emergency numbers, and he's using special web call assist systems. They have been developed by us in the last years. It's also an algorithm with clear click, read and click things where you can triage these calls. Depending on, maybe it's a medical emergency, then the call is going into the dispatch system and the dispatcher is sending you a kind of ambulance. So in Austria, we have 12 different types of ambulance. Ambulance with a physician on board, an ambulance without, an ambulance with a paramedic, with only a civilian service guy who is only doing patient transport normal. Or if it's not that urgent, you will be transferred to the other system. So we will connect you immediately to the nurse. And the nurse is also using a triage system. It's called low code. And this low code system is giving you an advice. Is there any need of going to an emergency room, or is there a need of going to a GP, or is there a self triage done? You can treat, or self-treatment. You can self-treat, and we are telling you what to take, what to do. So depending on the number, depending on what you're telling, depending what the algorithm is deciding, we are triaging you and sending you to the best point of service. And because of that, we have different types of call takers. So there are call takers which are only trained now for COVID, for the COVID crisis. We have call takers for this hotline thing. So these are actual screenshots from today's morning. So if you're an EMD, you are allowed to get emergency numbers. As you can see, they have emergencies on it. If you are a call taker, you only get patient transport and information hotlines. If you're a COVID call taker, then you're only getting 1415 at the moment. And the left side of the screen is depending on your skill. The right side of is the same, absolutely the same, depending on where you are actually located. And as you can see, not a lot of people. The first four are our branches. There are only 4 people here in St. Pölten. There are 5 people sitting on the branches. The rest is doing home office. All the others are working from at home. So we have only, let me see, 4, 8, 10, 15 people sitting in our call center, in our comm center, and we have 24, 30, 35, 40, more than 40 sitting at home and working from at home. The good thing is that with a click on the mouse, this is a screenshot from the 16th of March. On the 16th of March, we didn't establish home office that much. As you can see, the age here means they are at home office. So there were only, I don't know, six guys in home office at that time. All the others were in the branches, but they were really busy. 16th of March, we did a lot. And with a click of the mouse, we can connect, or we can, it's like call in, but they are not really coming. These back office guys, they simply connect wherever they are, and they can also get calls. So the good thing with the home office we offer is that there is no need that people are coming into our branches to connect. They can do it from at home. And if we need more call takers because of a big accident, because of a thunderstorm, because of whatever, we can simply alarm them, and within 2 or 3 minutes, they can additionally connect to the system and work like they would do in the branches. We also are using web call assist systems where you can simply read and click. So there's always a question and there is an answer. And because of that, the computer is guiding you through our system. And with clicking on, it's in German actually, because most of the calls are in German. It says here, do you have flu symptoms? Yes. And then it's asking a coronavirus pre-triage. Did you have contact to somebody with corona? No. Is the caller demanding a test? No. Did he call another corona hotline? No. What are his symptoms? It's fever and it's cough. And because of this, the computer is deciding, because of where the caller is living, because of his medical record, because of his symptoms at the moment, the computer is deciding he is getting a test, and he's only offering, if you click on the right button, this guy will be tested. And if you click on this button, the computer is showing you what to tell this guy to prepare for getting a test. We also started ENPDS protocol 36, which is the coronavirus or pandemic protocol within ENPDS, and it's also checking on each and every call. Maybe you're calling because of a heart attack or something else, and we are doing this pre-triage. Notruf Niederosterreich is also responsible for all the testing. So on the peak day, we dispatched 720 testings with mobile testers, like here this girl from the Red Cross. So we offer them web services. We offer formulas for the government where they can demand a test. We also were dispatching and coordinating drive-in test stations. That's all what we have been done within this pandemic. How have we been preparing? We have been doing clustering on all our branches. So we have these 4 branches, and within these branches there are big rooms with call taker booths and so on. And every call taker is member of one of a group, and these groups will never meet. They're only meeting inside this group. So if there is a positive test within a cluster, only this cluster is a problem. But in Austria, you have to do home office if possible. So 105 out of my 160 call takers are doing home office right now. They are not allowed to come. They have to work from at home. And as you can see, the small picture is a normal dispatcher workplace with screens. One of the 4 screens on the top, they only use normal for Facebook or chatting or whatever they do with it. It makes no sense normally. But as you can see, digital telephone, video telephone, and mouse click screens. And the same is at home. This small thing is the computer. He has 2 monitors. He has mouse, keyboard. They have to use a webcam, so I'm allowed to connect them and to see if they are working or not. They are using our paging system. We are using satellite paging systems to get information if there is a technical problem. Yeah, all the back office or most of the back office stuff is doing home office, and all the technicians, they are doing home office normally. It's not a special thing for us. It has been done regularly the last 2 years. What we did is to roll it out for people who are normally not doing home office because they didn't want it before, or it was not possible, or whatever. And we, all these other guys have to do home office. There are still people who are not able because they don't have the possibility at home. Yeah, that what I showed you. Home office is mandatory. And how is home office connecting? The same way our branches are connecting. They simply connect to the internet, and via the internet they have the same possibilities like in the center. It's a VMware system, so you can do it wherever you are. Benefits for the company of home office: we are ready for blackout, we are ready for the pandemic, and we have a backup, a perfect backup for peaks at incoming calls every time. So that's really cool. The benefit for the employees is they have more spare time and they are saving money a lot. So if there is a question in non-COVID times, they are saving petrol costs up to 3,000 euros per person. And we are lowering also the CO2 emissions per person. That's why we have been doing this in the past. So hopefully I could give you a short overview of what we did to be ready for the pandemic. And now I'm open for questions. Back to you, Gary.
All right. Thanks, Costa. Fantastic presentation. I have myself a long series of questions and comments, but I see already that we have written questions. We'll run through them, and then I will ask everyone to feel free to raise your hand. I see some people are already doing so, and my colleagues will then give you the floor. We will first run through the questions that are written. So the first one was by Arturas. Are you still using ELS GeoFIS?
We are using parts of it, but not really. All these web policy things and all these dispatch things have been developed by ourselves. ELS GeoFIS has end of lifetime, I don't know, 2023 or so. We are still dispatching some parts of our business with it, but we will kick it out completely by the end of this year.
Thank you, clear answer. The second question was, I have a question about the number of calls. Are these calls really all the calls that came in, or only the one that you were able to handle?
These are all the calls which have been coming in. We are handling all the calls. We have a callback policy, so if a call is disconnected, it is presented to the call taker, and the call taker has to do 3 tries to call back the person. So there is not a lost call normally. If somebody is calling the emergency number and hanging up before we are able to take the call, the people are very surprised that we are calling them back and asking, is everything okay?
Excellent. Thank you, very clear. The next question, sorry, questions are popping in, so I'll have to go up. Will it be possible to get the record of the webinar? Yes, we will send it to all the EENA members right after this call. I mean, right after. Give us a bit of time to upload it, please. So by the end of the day, it will be shared with the EENA members and available also on our website in case you're not an EENA member. All right, thanks for the excellent presentation. That's not a question, that's a comment, but I do agree with that statement. Before going for the rest of the written questions, somebody has hand. I will unmute Roger. I will do so. Up, Roger Cornelis, you had a question that you wanted to ask.
I hit the button by accident, sorry, but actually now that I have you online, I noticed that they only have one PC. Do they access the internet from that same PC?
Yeah, of course. Yeah. So no, we are not separating internet or our systems. No, they are connecting. If you're doing home office, you are Notruf Niederosterreich is paying the PC, Notruf Niederosterreich is paying the screen. We are not paying the internet. People are using the internet they are normally using, which gives us the advantage that we are not using one provider in case of one provider has a problem. So all the home office people have a variety of different providers, and it's a VMware. So they are going into our VMware, and it's not within their computer system. but they are only allowed to use the company provided computer for home office. If you connect an USB stick, for example, this stick will be destroyed. If you are trying to do something else, it is not allowed. So we are very strict on this, but yes, it's the same computer. It's not a separation of internet and our system.
Excellent. Thank you for the answer. I will go back to the questions list. So, yeah. Yes, I'm here. Do you hear me, Costa? Can a colleague of mine, like Rose or Marta, confirm that you hear me? Costa doesn't seem to hear me.
Yes, I hear you, Gary.
All right, so I'll proceed.
I hear you, Gary. Maybe we can give the voice
I
to
can't
Antonio
unmute, so that's a
from
little bit of problem.
Hyundai. He has a question also.
Sorry, there was so many sounds at the same time. I will proceed. You said, Marta?
I can give the voice now to Antonio Crispo from Hyundai. He has a question also for Costa.
Yeah, excellent.
Hello, you hear me?
I can hear you, yes.
Good afternoon. So I'm from Hyundai, Europe, and I'd like to ask you that we are looking for test our e-call system in our car for Austria, but in the past, every our request was rejected.
Why?
And now I don't know. When we asked 2 times to Austria, and Austria 2 times rejected. And
Just
the answer.
We can make it short. So we are also offering services for other things, and we are connected to other second phase ecosystem. Simply ask Gary for my contact details. Just contact me, and we can do that for you.
Okay, the main question that I want to ask you, if currently your PSAP centers support for the car the 4G technology. Means that if I have a modem inside my car that is 4G modem and make a call like SIP protocol, is supported by the PSAP center or not? This is my question. Thanks.
No, it's not supported. The nationwide official eCall service in Austria is done by the police. So it's from there, the data is coming to us. So we are not directly doing the e-calls, it's done by the Austrian police. But in Austria, most of the e-calls are going to the companies, to Mercedes, BMW, or Allianz, or Bosch, or whatever. And they are then directly connected to us. So they are sending us the data with a click.
All right. Okay, many for the answer there.
Thank you very much. Okay, so I will run for the other questions that are in the chat. So let me run through them just to be sure I don't miss them. Antonio had already asked his question. Did you consider to use the European wide number 116-117 for non-emergency medical assistance instead of 1450?
Yeah, 117 is also established, is also coming to us. It's the same like 1450. So you can try 116, 117, it's the same. It's all right. It's like 112 and 144. So we have this Austrian traditional 1450 for medical thing, but 116, 117 was established the same time we established 1450, and it's the same. It's also coming to our call taker the same.
Excellent. Another question is, and that's something I strongly wanted to recommend, by the way, is a visit to St. Pölten possible? Contact details in the presentation. You can go through EENA or directly look at the presentations where I think you might have left your
on the last page of the presentation. There is my contact details. So.
Yeah, and I will encourage as someone who has been there, spending some time with Costa. It's with my colleague Benoit at the time. Quick advice: don't drink too many beers in the train between Vienna and St. Pölten. That's something I would recommend if you go to see Costa. But before you get, I still strongly recommend you get there and you have a spend some hours or some days with Costa if you can to see what he's doing, as it's pretty impressive, as you saw. And I will add to that what Costa is presenting, he has been presenting for many years, especially about the remote, the home working. He's been presenting that for many years. So of course now it's more on this under the spotlight as we're talking about COVID-19 and the necessity to protect call takers and dispatchers. But his presentation is not that new. This thing he has presented for the last many years.
I simply brought together old slides, really old slides.
Yeah.
I want to tell you the short story why we started home office. We have a lot of young people here, and after a 12-hour shift, two of my call takers, it's years ago, it's really years ago, but two of my call takers died because of an accident when they were going home after a long 12-hour shift. And on the second funeral, I swear by myself, that will never happen again. There is no need to come to a modern command and control center. You can have the same services at home. A lot of call takers want to come here. So all the call takers at home, they simply say they are missing their colleagues also. The normal rule at my center is you have to do a minimum of 4 shifts in the center, and the rest of specific shifts you can do at home. To be resilient, not all the people can do it at home, of course not, because there might be an internet problem or whatever. So some of the people can work from at home, and some others can work here. And COVID made it possible that we can tell them it's more safe to stay at home. So then stay at home, and only the dispatchers and some of the call takers are coming here. But to be honest, a lot of people which are now in home office, they want to come. They want to see the other guys right now and have contact again. But it saves you money, it saves you time, it's more safe. We can, by a mouse click, alarm 100 additional call takers right now, and they will be ready for phone calls within 3 to 4 minutes. So whatever peak is coming, if there is a plane crash and we have to establish an information hotline, if there is something else, it's really a cool thing to have home office.
Excellent, thank you. I think that answers very well the question. In this time, since everyone is using the internet, the speeds are lower. How does that affect your home office workers?
No. That's a Austrian specific thing. I think, and I'm traveling a lot around the world and a lot around Europe, we have one of the best mobile coverage in the EU all over the world. We have 4G from 3 providers on each and every place. There was not one effect of lowering the internet, not one. And you, on my presentation is where I'm living. It's in Bayerburg. It's really in the outback of Austria, and I have 4G coverage of the 3 major providers, which is A1, it's Vodafone, T-Mobile, and it's 3. And yeah, that's not a problem we are facing. Even if we are doing Leo Mobile, which is our mobile comm center, we are doing this on big festivals. It's more for show that it makes sense. If there is a World Cup skiing event, we are there with a mobile, 2 or 3 mobile workplaces. Even there, we never ever were facing a problem. And with 5G, we forget it. If you have 5G, no problem anymore.
Excellent, Costa. I think that answers pretty well the questions. We still have time left, and I invite everyone to please feel free to continue writing questions in the chat. Meanwhile, while you are writing your questions, I have so many to ask you, so I'll continue, Costa. First one I wanted to ask is, I noticed that you have, you call it the doctor's nightline and a triage number, 2 numbers. Why 2 numbers?
Because the one is historical and the other one is new. Okay. I don't know why. It was a political decision to have a good new number which you can promote on TV. 1450 was established. We also have the traditional out of hours doctor line, which is 141. It's in service for the last, I think, 40 years. And
Okay.
141 is nearly the same like 1450.
Okay, good answer.
Gary, to make it clear, it doesn't matter which number you call. In most of the countries, you have to know the number you're calling. In Austria, simply call one of the numbers. They are all coming to us, and not the public has to know the number. We have to know what's your problem and send you to the right place. A lot of people are dialing the emergency number 144, 112, and they have no medical emergency. So we are triaging them, recognizing, oh, they don't have a life-threatening problem. We are putting them to local. Other people might, especially people from the countryside, they are only calling if your head is up from the body. So, and they are calling and asking which doctor is now open. And then you have to ask, why do you want to know? Oh, because I have a heart attack or whatever. Then you are in the emergency scene. So not the people have to know who to call. You have to know who to send and how to triage.
Yeah. Thank you, Costa. Another question I would ask is, so a little background. What we started to analyze some data provided by our members in the context of COVID-19, and what we seem to observe, and we are doing some further work on this, is that the countries that already had a well-established, well-known non-emergency medical number actually got an increase of calls towards this number, while the countries that didn't have a well-advertised or well-known by the population non-emergency medical numbers saw a drastic surge in emergency medical calls. So that's our first finding, because people, though an emergency medical number was created on the day, it was not known enough by the population, so the population would go back to calling the known emergency number or emergency medical number. What's your stand on this, and do you find that a non-emergency medical number is useful?
Absolutely, I find a non-emergency medical number is useful. We have been prepared because 1450 was there and we could use it. What should people do if there is no additional number? The only number they know is the emergency number, 112, or maybe a nationwide other number. So if they are afraid and they want to know about COVID or Corona, what should they do? They are calling. Of course they would. I would do the same. And if you have an additional number, you can direct the call amount to this number, and the emergency number is still free for a heart attack, for an accident, for whatever. So I'm really a big fan of having a variety of numbers, and at the end it's coming to the same place, but it gives you the possibility to technically make different queues and make sure that for real emergency, the emergency number is available all the time. And you can have, for example, less skilled person doing a pre-triage, because the only thing they have to know is how to read and how to click. To deal with a medical emergency is more than reading and clicking. But to give information to the people, that can simply be done by call takers.
Excellent. Thank you, Costa. It's very clear.
We have now another question for you, Costa, from Bulgaria, from Joseph Kalev.
Hello, Joseph.
Okay, hi, Costa. I was very impressed for your presentation, and especially that you have already implemented design, and when come this crisis, you are practically ready. And in Bulgaria, we shall do some additional things to establish additional number, also to establish additional workplaces for the call takers. I have some questions because we also use the EOS system. We know that is out of support, and we also will go to some other solution. We have now developed some concept on this side. I mean, can tell me first, if you're using call takers from home office, that means your apps for emergency leading cases is web-based. I am right?
Absolutely, it's a normal web page.
Yes, and you don't have any troubles with the security in this case. When
No,
you
because it's either a VPN solution or a VMware solution.
VPN solution, yes, we also use VPN, but when VPN is a software VPN, we have some troubles. It's not so reliable, this VPN connection.
Oh, we are using, as I said, we are using Cisco systems, so I'm not doing advertising for anything. There are other companies doing very good.
Okay, this Cisco POM4 also included PBX in this Cisco.
Yeah, we are using Cisco Call Manager for more than since 2000. We have been the first ever who was using IP telephony on emergency calls worldwide. It was established in 2004 when I founded this company. I was looking for a solution, and at that time we were establishing IP telephony. So in a lot of countries, there's a discussion about SIP trunk telephone. We have this for years and years, and that's nothing new for us. And that was a big advantage now in this crisis, because everything is digitalized. And for example, my MacBook is a normal working place. If there is a big thing and I want to log into our CAD system or whatever, I only have to have internet, and then I can do all the things. Traditionally, for example, New Year's Eve, I'm personally the officer in charge, but I am anywhere in the world. So normally I am in Florida, not this year, but I'm in Florida at New Year's Eve. It's 6 hours back. So at 6 o'clock in the evening, I'm sitting in Disneyland or nearby Disneyland, opening my computer, and I'm working the same like I'm doing at home. Then 1 hour later at 7 o'clock US time, 1 o'clock in the morning Austrian time, it's going to normal. I'm closing it and I'm again in holiday. So I can only say, be prepared and use modern technologies. Also look on safety. There's one big rule. Every home office computer has to have a camera like I have on my screen. And the back office people are allowed to call somebody in home office, and the camera has always to be open, that we can make sure there's nobody standing in behind, that you're really at home, that it works. There was, for example, the question of my home office people, can we do that also from a second home office? So maybe we're going to a holiday in France, not as a holiday, because I can work there. No, that's not allowed. Home office is home, where you are living. That's the only restrictions we have.
Yes, I see. As far as I understand, does it mean that you already replaced all ISDN trunks with SIP trunks?
No, yeah, we are using something like ISDN technology. So our provider is Austrian Telecom, and they are bringing the calls into our call manager system, Cisco Call Manager. They can come in via ISDN, old-fashioned. It will be replaced a lot, via SIP, via direct links to the mobile providers. In my presentation, you can see it. We have a direct link, 30 lines, for example, to Telecom, to Magenta. We have a direct line to Vodafone, A1. We have direct lines coming in from other places. It's redundant going in from different physical locations. So whatever. It's digitalized by the Austrian Telecom going into a system. The same is with digital radio. We don't have physical radios anywhere. I can have it on my computer here. We are also using a Cisco system for that, and yeah.
Joseph and Costa, it's super interesting, and I think what we may do with EENA, we might organize another session in the next month about specifically home working, because I see an incredible interest in that topic after years of preaching, Costa. so there is now a huge interest.
Some said you were crazy. Huh?
And so, Joseph, we will follow up on that. Not worry, it's a very important topic. I see also other questions related to the matter, and I'm afraid we may not be able to cover all of them today. There are so many questions. I'm going to look at them quickly and see if we could. Gaurav has left. What is the process if an emergency call is coming in over 1450 to a call taker in home office?
I didn't get this question. Can you repeat it? Sorry.
Yes, I will. Sorry, repeat it. What is the process if an emergency call is coming in over 1450 to a call taker in home office? So what is the process to define it?
The same. It's always the same process. Yeah. If you are if you are getting a call on the wrong number where you're not skilled, then you get the data because maybe AML data is in or whatever. You click a button and it's transferred immediately to a guy who is skilled for that. So it's an upgraded call because maybe you're only a call taker with non-skills for emergencies and the basic data is there. And there is no difference between sitting in a comm center or sitting at home. You have all the same services. It's a change of culture because even in our comm center, people who are sitting next to another are not talking if there is an information transfer, they are chatting because they are used to. And so it's a different way of working. But the systems you have in the comm center are exactly the same you have at home.
So there are a few other questions which again are related to home working by Dominic. I'll ask one of them. What happens if a CA in home office is lost while he or she is actually phoning?
Okay, because it's a VM where nothing happens, it's going to the next one. The real VM is like a virtual thing. It's recognized by the system and another guy can continue. It's the same like a lost call. It's the same like if a crash is on a computer and you're sitting in the branch.
Excellent. Again, we will organize something else on home working, but dedicated. Maybe I'm just thinking out loud because some of your call takers who could join and share their experience, because there is a whole aspect of home working. There's also the mental aspect, getting used to that, and all kinds of. So I think we will reorganize something. And I also know that there is a lot of interest, not from North America, in these topics right now, and so I think we have to continue explaining all of this, and you have a huge experience with that. It's now 1 hour.
Gary, just the last sentence. To everybody who's thinking about home office, it's only a change of culture. I was living in Australia in 1992 to 1998, or 1993 to 1998, and there they had teleradiology long before we ever were thinking in Europe about this, because of long distances, because of other things. And if you think about, we are used to go into the comm center and work there. Really, there is no need to go there. The only thing is, it's a waste of time for the people traveling from at home to the comm center. But make a special edition of webinar, home office webinar, where we can talk about this.
Excellent. Another last one I have to ask you, Costa, very quickly, is like I saw that there were the names of some call takers in the slides you shared, and we are about to share the recording of the webinar. I hope it's not a problem that we share the recording.
All the names of our call takers are also on the website. So when you go on our website, you can look, you can see what they are able to. So we are open.
All right, very clear and excellent. So we can share the recording, which I guess will be quite popular download or popular YouTubing in the next days in the EENA community. Thank you very, very much, Costa, and to all the attendees as well. As we said, we will follow up with another session. Just a quick note before we close it, we have another webinar on Friday at 2 p.m. Brussels time with Twitter. So that shall be pretty interesting as well. We have another one on related to COVID-19 on Thursday, the 14th with a presentation by the South Korean authorities. It shall be very interesting, 10 a.m. on Thursday the 14th. And there is another one, and if I ask Marta to tell me when it is, or Rose, there is another one, I think next week at some point.
Yes, there is one on the 11th of May on data analytics.
Webinar. Yes, exactly. Monday 11 at 3:30 p.m. Voilà, sorry, a lot of many webinars at this time. So join us. So thank you, everybody, and see you soon at the next webinar.
I thank you, everybody, for listening. Stay safe, keep the distance, but when it's gone, please come to Austria again as a tourist. We need you. Thank you very much.
Thank you, Costa. Thank you. Bye-bye.